Globally, about 9 million people annually fall ill due to the contagious lung disease, tuberculosis. According to the World Health Organization, about 1.4 million people die. In Uganda, 330 of every 100,000 people per year get this disease. UNAIDS statistics put the figure of HIV-infected people globally at 34 million people, with about 1.8 million deaths annually. Uganda is one of 22 high-burden TB countries and is also one of the 63 which have TB and HIV co-infection globally.
For example, we find about 50% of our TB patients that we test co-infected with HIV.
According to the International Union Against Tuberculosis and Lung Disease, 430,000 people died worldwide of co-infection in 2011. In fact, TB is the #1 killer for people who have HIV. Unfortunately, when these people go in for treatment, they never get screened or tested for TB. To experts, screening only requires a health worker to ask a few questions to an HIV-infected person, whether they have coughs, fever, night sweats, which are all symptomatic of TB.
If they have, they should then be given, TB medications as well as ARV medications.
Despite the close interaction of these diseases, programs independent of each other are being implemented. To TB and HIV experts, the way to go is integration if the burden of the two diseases is to be halved.
Especially for sub-Saharan Africa, we are seeing a co-infection of up to 80%. When health personnel deal with these clients, it's almost like they're dividing the client into two.
Since the discovery of ARVs, more people are living with HIV, and these are at a risk of acquiring the TB germ as the human immunodeficiency virus renders their immunity weak. People with HIV are 20 to 30 times more likely to develop TB than those who are HIV negative, while new TB cases are 19 times more likely to be co-infected with HIV than the general population. Unfortunately, not many countries have the integral approach. Botswana is already there. South Africa is getting started. Others like Uganda are wishing for it.
We have many more services providing TB services than HIV services.
Uganda's Ministry of Health boasts of having about 1,200 laboratories for TB testing with all the equipment. However, the health workers are few. The National TB and Leprosy Control Program advocates for HIV testing amongst all TB patients and suspects. But there's a challenge in this.
TB diagnosis is a very complex affair to get the full picture.
30% of HIV patients do die of TB, and usually this TB is not easily diagnosed.
Now, what is saving Uganda from not missing the TB cases in HIV positives is the new diagnostic machine, the GeneXpert.
These are still in a few sites, and we are prioritizing to use them among the HIV positive clients.
The wonderful thing about it, it can provide a diagnosis of TB within 90 minutes, but is all automated and is more sensitive. So the key thing on a diagnostic test is you want to be able to detect everybody who has the condition.
Co-infected patients must take their drugs, and these should be available and affordable. This calls for community empowerment.
They'll make sure that those clients receive their medications. They'll make sure that they receive food. TB had gone away from African countries. But with the advent of HIV, we saw them go up. So as long as we have HIV, there will always be TB because the two are really twins.
Uganda was a success story for many countries when the AIDS epidemic first struck in the early 80s. Now it is worrying.
In a country that was so effective before the advent of ARVs, so effective in bringing down the epidemic, that's the same country now with ARVs where the HIV cases are going up.
Experts say that the same principles that apply for HIV should also be used in TB, especially when dealing with key populations.
The fact is, in every African country, there are sex workers. There are men who have sex with men. There are drug users. We need to be able to target these populations, otherwise we'll never get to zero.
Data collected by the union in Myanmar concludes that TB and HIV epidemics work hand in hand to enhance each other's magnitude, impact the individual and the community. TB and HIV co-epidemic can be addressed only as a single common global solution. Structural and socio-economic changes are required for both diseases, and both have to learn from each other in order to be successful. This integration system will save governments a lot of money in terms of having the same personnel handling the patients. Besides, the patients get the advantage of going to just one center. Florence Nalimba, NTV.